PRioRiTy is a research project that aims to identify the most important things we don't know, in other words the uncertainties, about things that affect whether people stay involved in trials. The number of people needed in a trial is worked out in advance to make sure the trial's big enough to produce a sound scientific conclusion. If a lot of people drop out before a trial's finished, the trial conclusions may become unreliable or unusable. Identifying ways to minimise this dropout is of key importance for people involved in trials. Helping people to stay involved in a trial is called retention, and retention is the focus of this project, PRioRiTy. In other words, what questions do researchers, patients and clinicians have about how to improve retention in clinical trials? The most important thing in PRioRiTy is it will provide focus. So rather than trial teams doing what they've always done, PRioRiTy will give a top 10 list of the most important questions for researchers to focus on. Better retention is likely to bring better trial results and ultimately greater understanding of ways to improve health and well-being. To identify the most important questions for trial retention, it's key that we hear from as many different people as possible. It's really important that we hear from people who've been participants in a trial, or who might be in the future, or who have worked on a trial as clinical staff, or designed a trial and its procedures. Everybody has something to contribute to help us identify the most important trial retention uncertainties. All you need to do to get involved is complete our short survey. It asks 5 questions about what you think matters for retention in trials. The survey will be launching soon across several websites, and we'll post the links here at the end of the video once the website goes live, and we'll also promote the survey across social media. We hope that through your responses you'll be able to help with this research to improve retention in trials, and so further increase the confidence of researchers, funders and above all the people who participate in those trials and their results.